the first to go because it happens gradually at first. Many of us don't recognize how much of life has been a blur. In many cases, even glasses or contacts won't make it better. That's when it's time to take a closer look inside the eye and focus on what's really happening. And then let our next guest fix it. Here to explain, welcome back board-certified ophthalmologist Dr. Colby Stewart. Good morning. One of those things that a lot of us aren't really aware of until it's time is that thing called a cataract. And cataract is not like an eye disease. It's just something that's a fact of life.
That's right. I actually brought a little model this time, Deborah, to kind of show people what a cataract is, because I think a lot of people don't really know what a cataract is. I mean, patients come in and say, how many cataracts do I have in my eye?
Yeah.
Or do you peel it off? Well, when we're born, behind the iris is a clear lens. Almost looks just like this, perfectly clear. But as we get older, that lens gets hazy, and then it changes its name to a cataract. So when this lens gets hazy, there's nothing that you can do to put in front of it, contact, a pair of glasses, because the light rays still have to pass through this lens.
And we see that with some people sometimes. You look at their eyes, and they look like a little clouded.
You can't really see it unless you look with a, with a light through the pupil. Sometimes you see some haze on the cornea, which is this front part. But the cataract is actually back behind the pupil, the black part of the eye.
Okay, so like we're looking right here, like sometimes we see that kind of
in this case, look. Yes, and you can see in the left eye that that opacity there is a cataract, but that's with a flash, and also the pupil is dilated with drops.
And I would imagine that that person might be almost blind in that eye.
They're basically, that person probably can only see hand motion shadows.
Okay, some of the symptoms that you have a cataract that is maturing could be the cloudy, fuzzy, or foggy vision, which again it can happen gradually. So a lot of times people don't realize, but you're seeing things like this image right here, and then also color changes.
Absolutely. You can look back in the some of the paintings that were done in the very ancient times, and then you can see how the paintings and the colors, as the artist aged, the colors change.
Yeah, and then glare, like the lights at night will be just much more distracting.
Absolutely. I mean, glare can come from other things, needing a pair of glasses or whatever, but cataracts can cause all these symptoms.
Okay. In the old days, and also double vision is like another problem there. In the old days, the cataract surgery was something, again, that took a lot more to do, and some people would probably be, kind of afraid of it. But today, things have changed completely. Compare the two. Well,
I think, cataract surgery has really come along like with the rest of medicine. And one of the main things that I mean, 30 years ago, patients would come in for a cataract surgery, and usually we wait till the cataract was really almost like that picture
matured,
you saw, matured. And the patients would have the surgery. We have to make a fairly large incision as far as microsurgery goes, and remove the cataract in its entirety.
So I remember my mom saying, the doctor says I have to wait a little longer till it ripens.
Yeah,
right?
Well, ripens means that to the point where your vision gets to the point where it's affecting your activities of daily living. So we would take people like my father, who's an ophthalmologist, he would take the cataract out, and patients would be in the hospital for 3 days.
Wow.
3 days, and I would make rounds for my father, and we'd go around and we'd see these patients that had bean bags and patch over their eye, and now the surgery takes probably less than 5 minutes.
Is that your dad right there?
Yeah, that's Dad and I in 1996, and that's with one of my first cataract surgeries, and he was with me at Proctor, and he was one of the original founders of Houston Eye Associates, where I am now, which is the largest ophthalmology group in the country.
You can say like father, like son right here. All right, so today, that surgery is amazing. It's amazing what you can do, and so quickly.
Well, remember when we take the lens out, we break it up into real small pieces, but now we use a laser. In many cases, we use a laser to break the cataract up into small pieces. There's no stitches, no shots, no anesthetic. And when we take the lens out, now this is obviously very big for this model, but this is what the implant looks like.
We're looking at, yeah. There you go.
And so we also have different types of implants, and this would be like a restore implant. You can see these little tiny rings on it, and that enables patients, not only are we getting the cataract out and decreasing their glare and their fuzzy vision, but we can get them out of glasses for both distance and near vision. So after surgery, they can see distance and up close. Yeah. And this is even with people who wore glasses their whole life. All of a sudden,
have
you're
perfect
you're
vision.
fixing everything at one time.
And a lot of times people will say, like, well, I'll tell you, my mom and dad both said we have better vision now than we ever had in our entire lives. And so this is a really great thing that's happened here because, as we said, it's not if but when. So most of us will eventually develop these cataracts?
Well, everybody's going to develop cataracts to some extent. I mean, if I look at somebody that's 50 years old under the microscope, I can see a little bit of opacity changes in the lens. I say you got an early cataract, but it's not visually significant because it's not causing any problems.
Right.
If someone's seeing 20/20 and they have a cataract, we're not going to do a cataract surgery. We want to fix symptoms. We want to fix people that are having problems that cannot be corrected with a pair of glasses or contact.
Dr. Stewart has a special offer for Great Day Houston viewers, $1,000 off for callers who schedule LASIK surgery before August 1st. For more information, you can log on to colbystewartmd.com or call this number at 713-358-4340, 713-358-4340, and start seeing clearly just basically immediately after the surgery. Yeah. Well, when we come back, for adults, it's easy.